Dr. Denney over at Four Paws of Fulshear. Today, Maddie and I are going to be chatting a little bit about dog allergies and what they present with, how we manage that, what are the expectations for allergies in dogs, is there a cure, how do we treat, and different medications and signs to look out for.
Dr. Denney, how common are allergies in dogs?
So, if you lived in New Mexico or Utah, probably not so common because it's super dry there and they don't have the allergies that we have here. Here in Texas, like Houston, Texas, we have everything. Everything. I mean, I don't think there is a day that someone in my staff doesn't come in saying that their allergies is bothering them or having a sinus pressure headache or waking up with like a runny nose. It's Houston, which means it's hot, flat, humid, and the allergy counts are off the chain. So we have pollen, weeds, mold, trees, grasses, different insects. We can also sometimes see food allergies. I would say that the most predominant allergies that we see are mainly environmental. Occasionally we'll get some food allergies and we'll touch on that in just a little bit. But just to preface, dogs very rarely become allergic to grains. They are more commonly allergic to the main meat protein in their food, the most common being the most common ingredients, beef, chicken, or pork. So if you think your dog has a food allergy and you want to change food, so the grain-free, very few dogs are going to have an actual grain allergy. You really want to be changing the meat protein. I feel like that's a big, huge misnomer that we'll chat about a little bit later. But as far as like skin allergies go, they're everywhere. We see them every day, multiple times a day. I'm like the allergy queen of this talk. So this video that you're watching, I have this talk in exam rooms like 3 times a day, maybe more. So you're in good hands.
How do allergies impact the health and well-being of my dog?
So allergies are miserable. In dogs and cats, primarily dogs, we're going to kind of stick with dogs in this video. They can get recurrent ear infections. They can chew or lick their paws, both the tops and the bottoms. They can like chew their paws to the point where their feet are raw. And my own little Cavalier King Charles Spaniel, she chews her paws completely raw. Like right now, like today, the reason why she's here is not only that we're having work done at the house, but she chewed her back right paw, like it's like blood red. So she's here so I can get that addressed. They can break out in skin infections, so like flakiness or like scabs that are circular where the hair just like falls out, itching, dry skin, a smell. Like if you ever smell your dog's feet and they smell like overwhelmingly like Fritos, that's like yeast. Okay, so looking out for skin rashes. We can also see some eye allergies and upper respiratory, so you can get runny nose, you can get sneezing, coughing, reverse sneezing. You can get like increased like eye boogers that are like, you know, I don't have a problem cleaning them out. My husband like gags, but you can get eye boogers. So there, you know, these are some of the most common signs that you're going to see.
How will a veterinarian diagnose allergies in my dog?
So physical exam is going to be a huge part here. So I can ping pong, like my brain goes, allergies. Sometimes even like seeing on the schedule, chewing paws, paws are red. I'm going to immediately, my brain's going to go, allergies. Okay. And I'm going to confirm this on when I'm doing my physical exam to make sure that something else isn't going on. Like if something like a stinger stuck in the foot, or, you know, if a paw prad is injured, or a nail bed infection, something like that. But a physical exam is where we're going to be able to look in the ears and see, oh, does the ear smell? Is it red? Is the dog flapping its head and digging at its ear or rubbing its face on the carpet? You know, I'm going to ask these questions. I'm going to look at the skin, feel through the fur. I'm going to see, okay, are there any areas of redness? What do the bottom of the feet look like? If I'm finding scabs, you know, I might get a skin cytology where I take a microscope slide and I press it against the lesion and we actually go look under the microscope to see what is growing on the skin. Is it your own bacteria that's overgrowing because you're having these allergies? Or do we have yeast that's come in and taken advantage of skin allergies, or different types of bacteria? It also helps me choose an antibiotic. You know, sometimes if there's a red circular hair lesion, we're going to make sure it's not ringworm, because ringworm's contagious to humans, especially me, very contagious. So those are going to be some ways that we go ahead and diagnose these things in your pet.
What are some common treatments for dog allergies?
Okay, there's a whole bunches. So We're going to talk about supplements, okay? There are some supplements that are on the market that can help improve the skin barrier so the allergens can't get between the skin cells as well. Like when you take a shower, the reason that the water is beating up on your skin is because you've got a skin barrier. And when you have allergies, that barrier gets damaged. Medicated shampoos can help. They can go ahead and decrease the count of allergens on the skin, deal with the secondary bacterial infections that come with allergies, because allergies is an overstimulation of the immune system. Your immune system's doing something that it shouldn't do. It's freaking out about God knows what, and it shouldn't be. And when we get these infections, your skin, that bacteria that usually is at healthy levels, it's all over you. It's protective. It works in a symbiosis with your immune system. But when your immune system is off, like freaking out about good knows what, your skin's bacteria acts like teenagers when the parents have left home. They multiply and they have a party. That's what I call it. And they overgrow. So when we see these skin infections, often it's really an overgrowth of the dog's own bacteria. And not only does this lead to redness, inflammation, but it itches. Like it itches a lot. And then we just get the chewing, and then the bacteria gets worse. So it's a vicious cycle. But there are different medications. So antibiotics when they're appropriate, what kind of bacteria is under the microscope, antifungals, if we have a bunch of yeast, sprays, mousses, foams, wipes, all of these things that we use. There are some specific medications like Apoquel, which is a tablet that helps block the allergy response at the cellular level. A large percentage of dogs are going to respond beautifully, and within like 6 to 8 hours, the itching stops. This works in my dog. I can give her an Apoquel tablet in the morning, and by the time I get home, the licking that keeps you up at night, that keeps you up at night. If you have dogs with allergies, you're gonna know what I'm talking about. Apoquel stops it. Downside, it's expensive. It sucks. But it is a great product. There's also an injection that's very similar to Apoquel called Cytopoint. Same rules apply. A lot of dogs are going to respond really well. It does take a few days to kick in. There are some dogs that need a booster in a month, and that injection can last anywhere from 1, 2, or 3 months on average. That, if you have a large breed dog, that actually might be a better option than twice-a-day Apoquel financially. And then in really severe cases, I may reach for steroids. There are some side effects. I'm never going to put a dog on long-term steroids if I can help it, but they are cheap, budget-friendly, and they work. They suppress the allergies, but we do get some side effects, so we have to kind of be watchful of that.
What is immunotherapy for dog allergies?
So I'm really glad you asked this, because I feel like we have clients come in all the time saying, why does my dog have a skin infection again? Why do we treated this? We treated this 2 months ago. Why is it happening again? I thought you fixed this. I want my money back, or you didn't do a good enough job. We hear these things. I think expectations have to be that, think about yourself. We can't cure allergies. I'm not gonna magically take a pill and for the rest of my life never have hay fever again. It's never gonna happen. Allergies cannot be cured. They can only be managed. And the goal is to get them on a management program that fits everybody's individual budget and life and lifestyle. Because, there are some people that have the time to be doing baths twice a week and to remember these supplements and to remember to give the meds. And there's some people that have 5 kids and they're home for 6 hours and they need to be with their family, but here their dog is chewing their paws off. We have to be able to work within, the constraints of what the owner needs and what's going to be best for both the pet and the owner and for us. So going back to immunotherapy is similar to how people get allergy injections. So what are those? It's where we're training the immune system to not freak out about the various allergens that your dog is exposed to. I usually will send to a veterinary dermatologist who will do the allergy testing so we can figure out what are we allergic to. And then based on that, the dog can get put on allergy immunotherapy, either injections, they're teeny tiny little needles, or sublingual drops, so they're easier to give. I do think that the injections are probably more beneficial. It does need to be noted that it can take up to a year to see benefits. So it is not a short-term goal, it's a long-term goal. The other thing I would tell you is consider when you get a puppy, if you have an allergy-prone dog, like my doodles, we love our doodles. I feel like we have like 50% doodles of every kind of doodle, Bernedoodle, Labradoodle, Doodle, they're everywhere. allergy kings and queens. These dogs are allergy kings and queens. So consider getting some pet insurance as soon as you get them as a puppy, because that can help offset the cost, because you can't cure this, which means you're gonna have to be paying this for the 15 years, 20 years, I wish they lived that long, right? However long that your pet lives, this is gonna be something that you have to manage. So managing those expectations, creating like a health savings account for your pet, put $50 away a month as a puppy and forget about it if you don't wanna do pet insurance. But just know that, we are here to work with you as a team, but we too get frustrated that we can't cure allergies. There are so many things that we can do to help, but truly there's not going to be one answer. That's another thing that we have to remember, is allergy immunotherapy is not going to work for everybody. You have to approach it with multimodal, so you have to come at it from different angles. So I may do shampoo, antibiotics, antifungals. That's 3 different types of treatments, but I'm treating the outside and the inside. And it has to be stated that, hey, we just have to work together, and it's a forever thing. Allergies, they kind of suck, but we live here in Houston, and my practice is here, so I'm not going anywhere. And the great news is that you guys can come see me and we can work on this problem together. So stay tuned for my next video. I hope this one was entertaining.